Hey guys, welcome back to the Lawrenceville Bicentennial Podcast, a podcast where we talk to the people that know Lawrenceville best. Today on the show, we are talking about Project F.I.R.S.T, a special partnership between the City of Lawrenceville's Police Department and ViewPoint Health about a topic related to mental health, and it relates to every single family in our community. So I know you're going to enjoy this conversation on the Lawrenceville Bicentennial Podcast. Check it out.
Hey guys, and welcome back to the Lawrenceville Bicentennial Podcast. Today is a very special show. We're going to be talking about a current issue that's on a lot of people's minds lately. Communities are trying to figure this out, and Lawrenceville's got a little bit of a head start, and so they're coming in to talk to us about Project F.I.R.S.T. And today's guest, we have some folks from ViewPoint Health and the Lawrenceville Police Department. So we're going to go around the table, introduce yourselves, kind of tell what you do, how long you've been doing it. Sir?
My name's Jacob Beard. Currently, I'm an officer for the Lawrenceville Police Department. I serve as the Community Engagement Officer and the administrator of the co-response program, or Project F.I.R.S.T.
Okay.
Project F.I.R.S.T is kind of an overlapping term for our community engagement efforts and the mental health co-response efforts that we have going on. F.I.R.S.T stands for Intensive Response and Supportive Transitions. And rather than focusing simply on mental health issues, which is usually what is connected to the term co-response, we're looking more at social determinant issues. So if somebody's homeless, if they don't have food, or they have mental health issue, medical issue, those are the gaps that we're trying to fill in.
Okay.
I have done this particular type of work for the last 10 years. I started my career in law enforcement with the Gwinnett County Sheriff's Office back in 2010. And served as a sergeant prior to coming over to the Lawrenceville Police Department to do specifically this work. It's been great over the last year. I joined the team last June. We started our contract with ViewPoint Health, and it's been downhill for these ladies ever since.
Well, ladies, has it been downhill? How did you get to ViewPoint Health, and what are the jobs that you guys are both in?
I'm Anna Marie Smith. I came to ViewPoint Health straight out of grad school in May of 2021, and they had just started getting these contracts with different law enforcement agencies, and I was lucky enough to start at Lawrenceville Police Department as their co-responder.
Very cool.
On July 1st of that year. I'm a licensed social worker. My role is behavioral health clinician, mental health co-responder.
Okay.
Yeah.
Case
Awesome.
manager, caretaker.
Yeah, all of the above.
There you go. Very, very cool. Very cool. And how about you?
My name is Megan Wynn. I started with ViewPoint December, so I'm fairly new. I came from Savannah, from Georgia Regional Savannah, so I've always had a background with mental health and crisis. Since I've been here, things are just up and moving, and I love what I do.
Yeah, very, very cool, very cool. So let's jump into this program. We want to kind of explain a little bit about what it is for folks and how they might hear about it. You're basically, I guess the short of it is, if I was just put it in layman's terms, when there's something that goes down and the police are involved and you think it might be a mental health crisis, or you might think that the person might be have some sort of disorder, they're mentally impaired. I mean, what's the gambit? When do you show up as a co-responder?
So, is it okay if I'll jump in?
Yeah.
As I said a little bit earlier, in general, co-response is tied to the term mental health and law enforcement. That's where you get your intersection.
Okay.
In Lawrenceville, we try and take a broader approach at it. So arguably, when someone calls 911 and they're asking for assistance from the police, they have exceeded their ability to cope with that situation.
Right.
So that's a crisis.
Yeah.
If you look at the Webster's Dictionary, it's an emotionally significant event in someone's life.
Sure.
It can be a long event or it can be a more acute one.
Right.
So what we try and do in Lawrenceville, and what I've trained other officers to do, what we work to do when we go out on a scene, is we're trying to evaluate why we're interacting with this person.
Gotcha.
So a crime may have been committed, but why was that crime committed? Because at the end of the day, law enforcement's role is to maintain order. Now, if that is having to arrest somebody and take them to jail, that may be it. 90% of the time, it's trying to figure out what the situation is and address the concern.
Okay.
So where we come in is being able to connect people to the services they need. Over the last 30, 40 years, there's been this horrible misalignment in the United States of misuse of the criminal justice system. It's my personal opinion. Criminal justice system isn't broken.
Right.
It does exactly what it was designed to do.
Right.
But it is being misused.
Okay.
So,
I'm with you.
For a lack of better terms, I'll say failures of other areas in our system. Mental health, medical provision, insurance, banking, housing, all these other systems
Sure.
have created an emergent issue. And the population that we deal with, I'll say 100% of the time, is made up of those individuals that are historically underserved or marginalized because they can't access the services and resources they need other than calling 911.
Right.
So law enforcement, jails have become the de facto providers of these social services and programs.
Right. Which they were never intended to do.
Exactly.
Right.
So with that in mind, what Lawrenceville in particular has done, and when I started working in this arena, is law enforcement, understanding that there's a demand from the community for us to do things a little bit differently, is try to connect the resources with the people that need them, knowing that the people who need them are contacting law enforcement first. So embedding your social workers, clinicians, and service providers in the police department, it mitigates some of the issue of that connection. So if we go out, a prime example, when someone has a diminished capacity, whether that's from substance abuse, mental health, or a medical issue, if we go out and we kind of assess what's going on, these wonderful individuals have the ability, the training, and the expertise to say, yeah, this is exactly what this is, and this is the appropriate service. So then we can work towards getting that appropriate service rather than taking the person to jail.
Right.
Now, sometimes there are instances, criminal behavior is criminal behavior, and somebody has to be held accountable for that.
Sure.
And what I do in particular, is go past just the incarceration or the crisis intervention and work with the courts, the solicitor, the jail, to try and implement things to solve that problem on the back end.
Right.
But that arrest or that criminal adjudication gives us the ability to kind of force somebody's hand.
Yeah.
Right now, for instance, we're dealing with a young lady who she's adamant that she doesn't have a mental health issue, but from everything that we can see, and I can't diagnose,
right,
but I'm really good at telling if somebody probably does have a problem. And she's under the impression that she does not, and when we talk to her about that, very upset.
Sure, of course.
So the only way that we're going to be able to get her the services that are required is going to be going through the legal system.
Right.
But then it's going with her through the legal system and having the opportunity to interject the services that are needed with. Do y'all have anything y'all like to add on that?
I would definitely like to know, like, when you're talking about a phone call coming into 911, there's a situation that arises. You figure out that, okay, this is most likely, you've assessed the situation, I guess, when you get there. How fast does all this happen when the co-responder comes in? Like, when do you arrive on the scene? Are you on the scene? I just kind of want to paint the picture for folks.
I can tackle this one.
Sure, yeah.
I know 9 times out of 10 we prefer to ride with the officers instead of just going to the scene in our personal cars. So most of the times we're already with the officer. They'll handle the situation first just to make sure that it is safe for us to come into the scene. And after it has been just de-escalated, after that, then that's when we come in, kind of assess the situation, make sure that there is mental health there, or it could be drug related.
Right.
And then from there, we decide what it is that we're going to do.
So drug-related crimes, I mean, the statistics are pretty high. Like nationally, like if you've got even theft, burglary charges, it's usually like 60% or something like that of, there could be some drug-related charge in this. A lot of theft happens because, got to get your money to go get your score. You're not thinking clearly. Your beast brain's taking over. You can't do anything about it, and you're off to the races doing stuff that you would probably never do otherwise. So if you come to the scene, what do? How do you talk to this person?
Strictly drug related?
Well, I mean, just in that kind of situation where you've kind of diagnosed the situation. This person's here. They've done something, and you think it might be because they did a crime, right? I mean, you think they did a crime? Raise your hand. There you go, sir.
Sorry.
I know. No, you're good.
That's my picture on her profile pic, by the way.
Oh my God.
So I think the easiest way to answer that question is historically, when officers go to a scene, particularly for 911 calls, our job is to address that situation, solve it, move on to the next call.
Okay.
Yeah.
That solving is either a, hey, we can't help you, or an arrest.
Sure.
Right? Generally. I can tell you that 99% of the calls that officers in Lawrenceville, and I have the data to support it, aren't criminally related calls. They just aren't.
Gotcha.
Out of 36,000 calls for service in the last year, only 4% of them end in arrest.
That's good. That's good to know, because I think when you're telling the public these things and you're talking to them, they think every call is like, oh, well, something happened, something went down.
No, and that's the thing, is it's somebody who's looking for help. And 96% of the time,
Okay.
statistically,
I'm with you.
it is a non-criminal justice issue.
Yeah.
And I think the addition of co-responders, mental health professionals, case managers, whatever the title is, it gives you more options on a scene. He said, hey, we can't help you, or you're under arrest, or you get a ticket, whatever.
Yeah.
We can spend more time on the scene. We don't have calls pending that we have to go handle. We're not rushed.
Understood.
We can link you to services. We have knowledge about resources in the community. We work for the Community Service Board. We know where you can go for detox. We know where you can go for a mental health intake evaluation, all of these things.
Sure.
And we also just have the time that officers don't. And that's no shade to officers. They have a million other things to do in the day. We have the time to just, sometimes you need someone to sit and listen.
Yeah.
We can sit and listen.
I gotcha.
And that really can change a
And as
whole
long as
situation.
nothing is like taking place where there's a clear, the law has been broken.
So interestingly, and to Anna Marie's point, that's what this team is about, is freeing up our patrol and our detectives to do what they need to do.
Right. Okay.
Where the intersection, the nexus between mental health, substance abuse, homelessness, and law enforcement is nutty. And it has effectively been, and unfortunately been, criminalized.
I agree. I think I think you can see that just in the headlines and everything today. But as far as like criminal justice goes, it is sort of like, well, let's figure it out later. And then they put it into the justice system, and then they have to figure out
and so to get
what
to
it
my
is.
point of how we interact with individuals in terms of what do you need, it's not, okay, you have robbed a candy bar from a store, we have video of you doing that, and we have somebody who wants to prosecute.
Yeah.
When we're interacting with somebody, and the majority of officers now in Lawrenceville interact with, it's, why did you rob the store?
Right.
What do you need? So it's not a, what do we have to address? It's, what does this person need? Is the shift that has occurred in Lawrenceville.
Well, that's a big difference. I mean, that's a big deal. That is everything.
Absolutely.
Really.
And I can tell you the community's been on board. Even individuals, organizations, we deal with racetrack and QT quite a bit.
Okay,
People going in and stealing. They say, we don't want to prosecute. We may want to put a criminal trespass warning in place, but we don't want to prosecute for that. And they're cognizant that a lot of people just need help, and it's those social determinant issues.
Yeah. Gotcha.
Again, those ignoring a problem over time, whether it's housing issues, medical, mental health, anything. Officers have a specific role, and I'll say, fortunately, Lawrenceville, cognizant of what the community is demanding, they have given us the opportunity to step in and fill that gap. But at the end of the day, I'm still an officer. So when I go on a scene with these young ladies, my job, first and foremost, is safety and security. Earlier, Megan made the point that officer de-escalates the situation. Sometimes that de-escalation could be the officer having to get into a fight. But our ultimate goal is bringing that person to a point where then the clinicians can interact with them safely.
Right.
Because, I'll tell you personally, I have fought people and not arrested them.
Yeah, I think it was kind of unfair for me to toss you guys a hypothetical a minute ago. Let's talk about some success stories that we've had, because every situation is just different and it's unique. And so maybe, I don't know. I know you can't get into specifics, and there's probably some HIPAA laws or something involved. But
we'll leave names out of it, but everything we do is public record anyway.
Okay, well then there you go.
So, real quick, just some statistics just up front.
Sure.
So out of those 4% of arrests, okay, so we're going to speak specifically of the incidents that have ended in arrest. Those are what I would refer to as crisis calls for service. Okay, 911 calls that ultimately may end in somebody needing to receive a service or getting arrested, something like that. So that group, domestic violence calls, armed robberies, homicides, rape, solicit, like all criminal trespass, any sort of call like that.
Sure.
Where somebody, it's pretty obvious that somebody's in crisis. In that group, the average arrest rate for general patrol officers over the last year has been 10%. So out of I think it was around 2,000, 3,000 calls for service, about 2% of them, or 10% of them were ultimately arrested.
Wow.
Okay. Out of that 10%, stepping down, when a co-response was utilized, or a therapeutic intervention is how we refer to it, only 1% of those crisis calls that we've interacted with were ultimately arrested. Out of over 200 calls for service, I think only it's 260, it's close to 300, 260 calls for service, only 4 have ended in arrest. And it's because we're putting those interventions into place and trying. So at the end of the day, we're reducing crime.
Sure.
Right? But we're also saving taxpayer money because we're not putting people in jail.
Right.
We're not spending as much time. Excellent example, the first one that we really did, an individual who had, in the span of 8 months, over 60 different calls for service with the police, multiple interactions, had been arrested 3 times. So they were one of the first ones to be put on my desk. We got involved. And we had to spend some time. It's not always a clean cut, all right, we fixed the problem.
Right.
Yeah.
But what we saw with this particular individual is once we started doing some therapeutic interventions, the calls for service were reduced by 50%. And since November of last year, we haven't heard from them at all.
Wow.
But we were able to get them proper placement. They're in a group home. They're properly medicated. They're supervised.
Right.
So now they're not driving without a license, running people off the road.
I gotcha.
Causing
I see.
other issues.
Yeah.
But at the end of the day, they were committing crime. That's why they were arrested.
Sure.
But we were able to leverage that and get them the treatment that they need to be successful members of the community.
Right. Yeah. No, that's fantastic.
How about a story about a veteran?
Yeah, please.
Everybody likes a story about a veteran.
Of course.
We worked with a gentleman who was a Vietnam veteran, and he was living with his late wife's mother. They were not getting along. There were multiple calls for service that were domestic calls. And when we first met him, he wasn't even connected to the VA. He wasn't receiving VA benefits. He wasn't going to the doctor that he could be going to with the VA. He wasn't receiving mental health treatment. And he told us, I have a bipolar diagnosis. I've had some problems with substance abuse in the past. So we interacted with him. We kept in touch for a little while. And his mother-in-law ended up evicting him, going through the eviction process. So at that point, we said, you know what, we gotta do something now before he winds up.
Right, because he's going to be in a bad situation.
Oh yeah,
soon.
yeah. And
it's easy to see.
So we ended up getting him connected with the VA down at Fort McPherson. They have their community outreach center down there where they can provide housing and all those things. And he was placed in VA housing, and same situation. He doesn't call 911 anymore. He's connected with services, doctors.
That's a good thing to circle back on too and talk about. So if these folks, who would normally in a regular situation or in the past historically, they would be going to jail. When you talk about reducing that percentage, the way that you did there, these folks are not just you're not just leaving and everything's peachy. There's a place for them to go. You're just making sure that they get to the right place, they get the right help that they need so that this doesn't happen again. So you're circumventing the process. So it's not a matter of probation, restitution, a court-mandated rehab facility or mental institution,
Less
something
punitive.
like that. It's punitive, right. So this is voluntary. You're getting them to, is it voluntary?
Sometimes.
Okay.
So I'll
With
say
this fellow, it was.
It's
yeah.
complicated,
This-
folks. Look, it's not an easy topic we're talking about today.
Going back to that misalignment of services, right? It's inappropriate that an officer is the one that's pushing, I'll say, the social justice reform, but that's what's happening.
Sure.
And a lot of times, as well as that misalignment of services, it's miscommunication. At the end of the day, we all want the same thing.
Sure.
Absolutely. I've been an officer for 12 years. I've never met anybody who's just like, oh, I love going out and beating people up and arresting them and doing all this.
Yeah.
I haven't. And I've worked for 3 separate agencies.
Right.
One of them was the 3rd largest one in the state of Georgia. I've met a lot of officers, and they certainly don't get into it for the pay. I know I got into it because I wanted to help people.
Sure. And
fortunately, and God willing, I was able to find this niche of restorative justice.
Right.
And it's all encompassing. And you can talk to any officer in Lawrenceville, and they seem to have an understanding that every officer has the duty, the authority, and the ability to work in this arena where 99% of the time we're just waving, saying, how you doing, helping change a tire. Mm-hmm. But that 1%, we have to be willing, able, and we have to do it professionally.
Sure.
To use force to address situations or to arrest somebody. And that's the unfortunate end of the spectrum. But it's also a misunderstanding of the public. If you watch Cops or Live PD,
oh, yeah.
What do you see? All the whole time, chasing people.
Oh, yeah.
Dude, I've been an officer for 12 years. I've chased people in the woods. I've pulled them out of cars. I've served warrants. I've been on tactical teams. I've responded to riots.
You've never had a Poncherelli, like a motorcycle buddy that
No,
you
I did
went
not.
out on
I had
adventures with? And there was always a car that exploded as you
Right.
ran away from in slow motion? That never happened?
That's
out of-
disappointing.
I know, man.
I've done a lot. In 12 years of being a peace officer in the state of Georgia, 12 years, I have only arrested 8 people.
Wow. That's actually pretty impressive to be able to say that, because you think about just the public's perception of this thing. Mm-hmm. And that's why we're talking about it today, to kind of get some of this out there, to talk about what is really going on and what is the story, because you have headlines that are across the board on this issue. You know, people might hear, oh no, mental health professionals are going to be driving in the police cars, and so now they're going to take the guns away from the police, and we're going to stick Band-Aids on people.
So and it's funny because you hear people say, "Oh, clinicians need to respond to this." No, clinicians should have dealt with it back here.
Yeah.
The connection didn't occur, right? But and I don't want to speak for these young ladies, but they probably don't want to work 24-hour shifts.
Yeah. No.
They probably don't want to get shot at or punched or hurt.
Right.
So that's where, officers, just as much as there's this ambiguity and misunderstanding for officers dealing with individuals who suffer from a behavioral health issue, there's also ambiguity for the clinicians. They're not officers. Mm-hmm. We can't expect them.
So to throw it back over to you guys, maybe, and we did kind of cover some of this a little bit, but what is the relationship between ViewPoint Health and Lawrenceville? Just to kind of cover it, because I feel like we've jumped into a deep swimming pool on this issue, and so I want to back up just a little bit and say, what is that relationship? How did this get started?
So before ViewPoint Health had contracts signed with law enforcement agencies like Lawrenceville PD, they were the community service board, and still are the community service board provider for Gwinnett County. And that just means that they are the go-to mental health treatment, substance use treatment, for people who are lower income, people who are uninsured, things like that. So they've been a long-standing mental health provider in the Lawrenceville community. And I believe it was the early months of 2020 that they started reaching out to law enforcement agencies. Chad Jones and Pej Madavi started this co-response program. They came up with this idea, started reaching out to law enforcement agencies, and what we do is they sign an MOU with a law enforcement agency like Lawrenceville Police.
Memorandum of understanding.
Thank you.
Contract.
And a contract, yeah.
We like our acronyms in law enforcement.
Yes,
There you go.
that spells out, what our relationship will look like. So for Lawrenceville, it's that there's going to be 2 clinicians who will serve as co-responders. We are ViewPoint Health employees that are embedded with the Lawrenceville Police Department.
And so what is like a day in the life? Like what is your day to day if you were to walk me through that situation?
Well, our day-to-day is definitely not the same. We don't have a typical day. You may come in contact with the same individuals, but mental health, you don't just have this one big picture. So for our day-to-day, we have different hours. Being 2 clinicians, we try to be flexible so we can cover like morning shift, night shift, because it just doesn't stop. We get in, we make sure we announce that we are in service. Sometimes we may ride with officers. We may stay in the office, which is at the Lawrenceville PD. We have our own office, and just do follow-up work, contacting clients that we came in contact with maybe the day before. Just checking in to make sure that we're still here.
You're building a relationship, it seems like, and when you guys tell the stories, like you really get to know these folks. It's not like a one and done. You go out on the scene and then you send them to the place and that's it. So you get to know these folks.
We have work phones. They call us all times of the day.
Wow.
We could be at home, but our job it doesn't stop.
I gotcha. I understand. Fascinating. Yeah, I think this is a really, it's a great way to serve our community and the population within Lawrenceville for sure. Because all of these folks are our residents and citizens. And in a recent podcast, we had both Chuck Wormington, Mayor David Still in here, and they were just basically just sharing. They didn't really share a whole lot about this program. They did talk about it a little bit, but the way that they talked about it, I found just a very compassionate view for folks in the community, especially among homeless, mentally ill. I mean, what are we doing for our citizens? You don't have a program in place like this. Like you said, you're just basically showing up, and the only thing you can do is have an arrest happen if there's been a crime or if it's needed, and then figure it out later in the justice system, which it's never supposed to do. So is Lawrenceville the first city to do this in Gwinnett? Where was it predecessors? Like, tell me a little bit about the history of that.
So Lawrenceville Police Department was the first city agency to establish a formal co-response program.
It's awesome.
About 4 years ago. Was 2022? Yeah, 2018, 2019.
Okay.
When I was still with the sheriff's office, I had a clinician that was assigned through MOU to the jail.
Okay.
And their primary responsibility were to do mental health evaluations and start setting up treatment plans for people that were leaving incarceration.
I gotcha.
But while we were doing that, we started establishing relationships with agencies. So myself and that clinician, actually at the time we called it pre-incarceration diversion.
Okay, yeah. That's a good name.
So
I like that name. Did you come up with that?
No, that's actually a term.
Oh, it's
that's
a term.
utilized.
It's a thing.
It's a thing.
He just threw that out there. Brilliant.
So but we called it pre-incarceration diversion because as a sheriff's office, our primary responsibility is the jail. So the incarceration component.
Okay.
So when we were doing the pre-incarceration diversion, myself and that clinician would get calls from Lawrenceville PD, Gwinnett County PD, Suwannee PD, any of these organizations.
Wow, yeah.
The ones that primarily utilized that were Lawrenceville and Gwinnett County.
Sure.
And we'd go out with those agencies and we would provide this co-response service back then. And so that kind of evolved. Pejman Havi, who is with ViewPoint and helped really establish this, he did it back in California years ago.
Wow.
And so he has a lot of firsthand knowledge of how it works and started to really formalize it. So that's developed this MOU contractual process with agencies in Gwinnett County. So Gwinnett County PD has a co-response program. Lawrenceville has a co-response program. Norcross, and I believe other agencies. Lilburn is in the works or talking. So it's the fire's spreading, so to speak.
I see.
Because it is needed, and we're all working together too.
And so there's like a list of resources for folks. It might not be that just these folks are going to ViewPoint, or there's like a place that they're going to, one place that they're going to specifically.
Right.
As we're talking about it, I just want to communicate that there's like a whole list of resources of where people might go to get help, and obviously specific to the thing that they're dealing with?
So in developing my system, particularly in Gwinnett County, which is where my network is, I'll say the Lawrenceville Police Department has connection and access to over 80 different organizations.
Wow, yeah.
That provide anything from housing to transportation assistance, medical care, mental health care, substance abuse treatment, you name it, we know somebody who does it.
I gotcha.
And we try and facilitate that connection because the picture looks different for everybody else, but everybody has the same needs. All humans still function in that Maslow's hierarchy. So the way we look at it is income, housing, and transportation. If you can answer those three questions for anybody, then you can get them to a point where they're able to excel.
Right.
And whatever that may look. And it looks different for everybody. Some people will be able to hold down a 9-to-5 job. Some people may need to get disability. That's their
Yeah,
income.
exactly. And I think that the knowledge about the resources and like the connections that the Officer Baird's mentioning is half of that. And then the other half of leading to success is having people who are helping to facilitate that, who have the time to give you a call and say, hey, did you remember to check in with so-and-so at the VA? Or, hey, did you ever get on the phone with the food stamps office? So helping to facilitate the individual in the community getting connected to those services.
Right.
Because they're not easy. It's not easy to navigate a lot of these social services.
I would imagine.
No.
I would imagine so. I mean, it's a matter of resources for a lot of these folks. So if you, like you mentioned before, if they're lower income or if they're on, welfare, or if they're just unemployed, or if there's no family, there's no one to pay for a rehab facility or something like that. Like
those are the people that we generally work with.
Right.
The ones that have ultimately been ostracized or condemned by their family for whatever reason.
Right.
And it's understandable, individuals who are caretakers of folks who have a substance abuse disorder, mental health issue, or any myriad of problems, it's frustrating for them. So, and I want to be clear, like, these ladies do an incredible job of not just working with the folks that we have to go and interact with, but their support systems as well. So those caretakers of the individuals, Anna Marie and I interacted with a young lady who has autism and runs away from her home when she gets frustrated. We were able to sit down with her and her mom and just create a safety plan and hash out a few things. And it's just knowing, and the mother of the young lady made the statement, I had no idea this was available. Like,
that's great. So hit on that for me. I don't know if you can hit on that for me, but just if someone wants to has an issue right now, is there a number to call instead of 911, or do you have to call 9? There's a number to call instead of 911.
We actually have it posted on our website, and I think the city of Lawrenceville posted it on theirs as well.
Okay.
If not, then they have plans to.
Right.
But the non-emergency number for the police department, and then through the phone tree, if you dial 3, rings that phone. And I answer it.
Fantastic.
Anytime, day or night.
Because I would imagine that there are some families that are not in the crisis situation yet, but it's well on its way.
Right.
I mean, they've already seen the signs. They already know it's coming. They're just waiting for the bottom to fall out. And they know one day they're going to get the call, and their loved one's been arrested or something's happened to them, and they're left without anything or any choices to do. A lot of these families, too, I think it's worth saying that you don't know general information on how to deal with someone with schizophrenia or how to even deal with an addict in your home. I mean, because no one's like doing research or learning about this in school except for you guys, So when something hits a family, they have no idea. There's not a resource or anybody to call. They're on the internet, going to Google, looking up whatever their best guess is. So is there any advice, any thoughts to families? What do you guys tell folks?
Just to piggyback off of what you said, as well as you, I know a lot of times we may come in contact with a client and they may be just so psychotic that we're talking solely with the caretaker, the parent, the guardian, whatever the case may be.
Sure.
And it's just providing that basic education on services, on what you can do next. I know a lot of times if we go like a 1013 route or either just a voluntary commitment, we may contact the hospitals just to give that brief update to the parent to let them know what's next and what usually happens. I think a lot of times that, just being that listening ear, just providing that extra support for them, because it's very stressful on a caretaker just alone, let alone a mentally unstable person. So I know a lot of times with our linking our clients to service, I think it's about maybe 42%. And that may be based off of, it's based off a lot of stuff. Income, your insurance. Like my coworker said, for ViewPoint, that's just based off of like low-income families, patients without any insurance, things of that nature. But of course, if they do have insurance, we have to go a different route, or just let them know, hey, call the number on your insurance to see who's exactly in your network. So.
Right. And but you can at least help pinpoint them what they're looking for or what they're asking the insurance company to do.
And sometimes we may even go the extra mile and like just, hey, like you're right here, let's do it together.
Yeah.
So
I think the thing that keeps people from calling a lot of times is just the stigma wrapped around mental illness or that person in your family.
Yeah.
And I just want to be very clear with our audience today. We all have somebody in our family. Guys, it's not your mother-in-law. Always. But my mother-in-law is great, by the way. Just want to say that. Didn't mean to make a mother-in-law joke in the middle talking about mental illness. But I will say it is real. It's a real thing that there's a stigma, and we get afraid to say, well, we're really dealing with this in our home, no matter what it is. And so we don't talk about it. And then we get into our little vortex and zone of trying to find information for ourselves without asking anybody for help, because we don't want anybody to know that we're looking for help.
Exactly.
So it's like a vicious cycle that ends. And to have a resource that you can call and talk to folks that at least know how to guide you in ways of what to look for, or the right questions to ask, or what to do when this sort of thing starts to happen in life, so that it doesn't always end with a 911 call. I think that's super important. Guys, I think what you guys are doing today, fantastic. I think it's awesome for the city of Lawrenceville. I'm glad we got to clear up some of the misconceptions and some of the thoughts and kind of get into some of the details surrounding this. This honestly could probably be one of those topics that could be its own podcast. And we could just meet every week and tell stories and talk about the statistics and the issues, because this will be a nationwide discussion for years to come, really, as this thing continues to develop, because it really changes the face of both law enforcement and then our engagement with our citizens, which we want to care for in the best way possible. And so you have to have these kind of relationships. Is there anything else you guys want to add before we wrap up?
I want to say that we are so lucky to be in Lawrenceville. Officer Baird mentioned earlier that the police officers that we work with they're truly fantastic. I've seen so much compassion and love for the people that they serve. I'm amazed to see that. Our city leadership is so supportive, and the community of Lawrenceville. Like he's talking about the people who work at the Quick Trip and the racetrack. They're calling and looking for help for these people.
Yeah.
So we're in a great community.
That's fantastic.
our job is very rewarding.
Yeah.
Very.
Yeah, I can imagine that. When you serve others, there's so much more benefit that comes back to yourself. You don't really realize that that's the game. So thank you guys for being here today. I really appreciate your time. Thank you for talking about this topic with us. And guys, listening to the Lawrenceville Bicentennial Podcast, tune in next time, because we're continuing to talk to the people that know Lawrenceville best, all the ins and outs. You guys subscribe, like it, send it to your friends, especially this one. Just share it with somebody who you feel like needs to listen to it and might be able to help them out of a situation before it gets too sticky. All right, guys, have a good one. And until next time, we'll see you soon.